because we're taking you deep into town. It's all about our Ghana Connect at Town Hall, the latest Citizens Manifesto. Mustafa Gbande is there. Haruna Mohammed is there as well. Blessed Soga is hosting, and we're taking you live to that location currently.
And on the Ghana Connect Town Hall here on Joy News. Indeed, we are your election headquarters, and that's what we stand for. Over the last couple of months, we have been crisscrossing this country, trying to seek your views as the electorate going into the 2024 general elections. We have been to the northern region, to the Ashanti region, and now here we are in the national capital, the Greater Accra region, here specifically at the Osu Presbyterian Hall, seeking your views again as part of the Ghana Connect Town Hall. My name is Blessed Soga, and wherever you're joining us from, we are glad that you're making it a time, of course, spending some time with us here on the channel to also share your views, share your opinions with us, to shape the narrative going into the 2024 general elections. We are on your favorite channel, the Joy News channel. We're on Joy 99.7 FM and across the country on many or some of our affiliates. So you have the opportunity of listening to us wherever you're connecting from. Thank you once again for joining us. Here in the Greater Accra region, we're having our Ghana Connect Town Hall, largely because of the support we're enjoying from Send Ghana. And Send Ghana, of course, has been leading that advocacy in the space of social protection, and we are glad that indeed they are supporting this cause. So for my audience who are listening to us and watching us now, why don't we give a round of applause to Send Ghana for supporting this great cause that we have today. Well, we're making this about you, the electorate, the citizenry. And that's why we're calling this the Citizens Manifesto. Very often we have the political parties determining to us or telling us what it is that they plan to do. Already the season has provided us with that opportunity where we are hearing from the main two political parties. Of course, they have had the opportunity of running the affairs of state over the course of our 30-year democratic journey. So it's again a good reason to hear from these political parties as they go through the process in formulating their policies and manifestos ahead of the 2024 general elections. We've already started hearing some campaign promises, but we want this process to be about you and about your livelihood. That's why we're providing you this opportunity to directly interface with the political parties and ask them what they have for you going into the 2024 general elections. I'll be telling you shortly about the representations from the National Democratic Congress and the New Patriotic Party, but we are calling this the Citizens Manifesto because we want you to be at the forefront of asking the questions, asking the political parties what they've done in the past and what they'll be doing for you in the next 4 years when given the nod. So what are the issues? How do they affect you, especially when it comes to social protection and livelihood empowerment? That's our main focus for today. So just be prepared for us. If you're listening to us on television, we're also streaming on all of our social media handles, so you have the opportunity of sending across your messages. Feel free to do so on all of our handles. On X, on Facebook, it's at Joy News. So feel free to send across your messages, and we'll be happy to share them with the political parties joining us here. Very shortly, I'll be allowing the citizenry, of course, those who have the opportunity of being first-hand people joining us in the hall here, to put their questions directly to the political parties. But it is also instructive for us to note that we have quite a good representation, because this is from the national leadership of the two political parties, the main or leading ones, of course, that are joining us for the conversation on Ghana Connect Town Hall for today. So why don't I start off by introducing them to you? Please, with a round of applause, let's welcome Mustafa Gbande, who is the Deputy General Secretary of the National Democratic Congress. We're already hearing of the 24-hour economy. We'll see how social protection features into that. Then we have, of course, the New Patriotic Party's Deputy General Secretary as well, Mr. Haruna Mohammed, joining us this morning. and their mantra is breaking the 8. So we'll get to it shortly and see how social protection also features into that. So if you're having some concerns already, or of course you've jotted by now, I believe, some of your main issues that you'd want to feature in the manifestos of the political parties, you should start preparing yourself, because we'll be moving the microphone over to you, so you can start off by having, the opportunity of asking them directly what bothers you in your community, what you want the political parties to do for you, because this is an opportune time, especially for the New Patriotic Party. This weekend, we understand, Haruna, you're heading to the Western region, correct? And that's because Dr. Mahmoud Bawumia, we understand, is taking a break. Then he would formulate the policies that he intends to govern this country with in the next 4 years, if he is indeed given the nod. But the NDC has taken the lead with a youth manifesto. We will probe that document, try and see how it also addresses your concerns. But let me give the opportunity, just before I come to you, my audience, to the political parties, so at least give us a brief sense of what to expect. First of all, from the New Patriotic Party, as we know that they will be leading the charge to the Western region for the official outdooring of their manifesto. Then the NDC will be joining the NPP again later in the coming days to also outdoor their manifesto in the same region. So that's an interesting dynamics. We'll be watching that closely. But let me start off with you, Haruna Mohammed. We're just under 125 days to the general elections. We've had so many promises, had so much from your candidate, Dr. Mahmoud Bawumia, who's been across the country already, giving his sense of what the NPP or the future NPP government would look like if the people of Ghana give you the opportunity come December 7. But tailoring that to social protection and livelihood empowerment, I want to hear from you, in a nutshell, what do you have programmed for the people of Ghana going into the elections?
Thank you very much, Mr. Bless. I would first of all say good morning to the Charis US and our able representatives in this particular hall, representing the citizens of Ghana. I am here with my colleague, the Deputy National Organizer of our party, Mr. Joseph Kwayaja Nganiba, who is sitting within the citizens here represented. I also want to say good morning to my brother. I want to share one for you.
Yeah, indeed. And of course, I was monitoring the conversations, the hearty chat you guys were having before the start of the event. I understand there's a little challenge with your microphone, so we'll give you the opportunity shortly. But I also need to announce to you, if you're watching us, that we are on the Joy News channel. We're on Joy 99.7 FM. And of course, this is made possible by Send Ghana. So Send Ghana is supporting our Ghana Connect Townhall, which we are bringing to you live from the Osu Presby Hall here in the Greater Accra region. But that's not the end of the opportunity, because in just under 100 days, of course, we'll try as much as possible to avail all our platforms to you as the electorate, to let your voice be heard and speak directly to the political parties, so we're able to tell what you want to see featuring in their manifesto and their programmed activities going into the 2024 general election. So very shortly, we'll hear from the political parties and tell you what you need to know about their manifestos going into the 2024 elections. But we are giving you the opportunity, wherever you are. Very shortly, we'll have those in the audience ask directly their questions. So if you're in and around Osu, you also have that opportunity to come right into the Osu Presby Hall. Then you have the opportunity to interface directly with the political parties on social protection, livelihood empowerment. These are key issues that, of course, I believe you'd want to take a look at going into the elections, because what we've seen in terms of data over the last few years is that there's an instructive document that we're working with, of course, that Send Ghana has released ahead of the election, which is pointing out a very worrying trend of reduced spending when it comes to the social protection space. And if you see that trajectory, you would, of course, as an electorate, be concerned about why there is lower spending in terms of healthcare, in terms of housing, and all of these issues, and how, of course, as a country, collectively, we can, of course, boost the numbers and to get more social protection interventions for you. So these are some of the issues that will be featuring in this conversation. We're live on the Joy News channel. We're live on Joy 99.7 FM on all of our social media handles. You do have that opportunity today, as we call it, the Citizens Manifesto. So what's going to influence your voter decision going into that election, and what would you want to hear from the political parties? That's why we're here today at the Osu Presby Hall. So wherever you are, just feel free, come along. We will provide you with that opportunity to do so. Very shortly, my audience will have a first take on their question going into that exercise. And of course, we're back again. We have, of course, the Deputy General Secretary of the NDC, Mustafa Agbande, and Haruna Mohammed is the Deputy General Secretary for the New Patriotic Party. Haruna, you're talking about the road to Western Region, of course, ahead of your manifesto law.
Yes, thank you very much. I started by extending greetings to our viewers and listeners on radio and our audience in this particular hall. And I acknowledge the presence of my colleague, which is the Deputy National Organizer of our party, Mr. Joseph Kwayajan Ganiba. And I think that this is a very good platform, and I must commend Star Ghana for this particular, Sent Ghana for this particular sponsorship, and also commend you, the media houses, to be able to bring us closer to the citizens, to be able to ask the appropriate questions and seek clarifications on our governance system. The whole essence of democracy is for us to live within the means of the people and provide as much as possible what we can do to be able to solve societal problems and what have you. So for us to have this particular interface is a very good interactive session that I think that it is very laudable, and I must commend you. My brother happens to have been given independence by us from Zabzugu, because we're all together until we gave Tatali a constituency in 2012. We have been very accommodative of issues that we have, even though we are from different political parties. But I think that the NPP will forever remain the superior political party in this country. Yes, we are heading towards the Western region, where we would be launching our manifesto, which we say bold solutions for our future. Our manifesto is going to be strand on bold solutions for our future. The Breaking the Eight is a historic event that we want to do, spanning across the Fourth Republic, where no political party has been able to make that attempt except the NPP when we did so in 2008. We fell short of very few numbers, where we had 49.something% by His Excellency, the current President of the Republic of Ghana. And we are seeking to repeat and to reaffirm and make sure that this history is written in the history book and annals books of this particular country. We are seeking to do so on the wheels of the people of Ghana, based on the social contracts that we have signed with them previously in 2016 and executed same through to the admiration of many of the people of Ghana, which can be confirmed by our own citizens through which we represent. On that particular strand, we want to stand on that particular grounds to make an effort to get back to government to continue the good works through a renewed energy, who has not been given the opportunity before, who has not been tested before, and who has proven that in his bid to assist will be able to insist when he's given the opportunity and have the powers as enshrined in the 1992 Constitution. And that person, His Excellency, Dr. Mahamudu Bawumia, who has demonstrated enough courage in this government to have championed the introduction of 36 policies in the governance of Akufo-Addo's government. And
you say 36 policies?
Yes, 36.
36, okay.
36 policies that he has championed in this particular governance, one of which is the drone system. We all know how medical facilities, how our community health nurses have suffered. Some of them had to die in the process of moving from one community to one community through this AG motorbikes. Some of them have been attacked, and we know how snake bites run so faster to be able to take the lives of the citizens. It took a gentleman in another Akufo-Addo's government, where Dr. Mahmoud Bawumia, where his father suffered from this particular situation. When we were going to introduce the drones, we were told by my brothers, their national women organizer, that we'll be using these drones to take naked pictures of people when they are bathing in their houses. Lo and behold, we have been able to use these drones to support delivery of medical supplies, over 28,000 medical supplies, to save human life. This year, this drone has contributed immensely to educational development in this country by delivering papers to remote areas where water had taken over their roads. This is as a result of a visionary leader who has championed the cause of transformation. And another one that we have been able to do through him is the digital address system and the Ghana card system. Today, banks have lost credibility in terms of money liquidity, where they have not been able to sustain their liquidity levels, what have you, just because of bad loans. People take loans from one bank, go and pay to another bank, and here and there. Today, you cannot do that because the Ghana card has become a centralized system where when you move from one bank to another bank, the bank will be able to assess to know that you have taken a loan from GCB and you are coming to Consolidated Bank to take another loan and use that one to pay.
So the Ghana, I'm sorry for practicing, but the Ghana card is your social protection intervention?
I am telling you the interventions that the vice president, the vice president and the flag bearer of our party has championed in the course of his vice presidency to be able to change some certain aspects of our governance system. So in his bid to assist, this is what he has been able to provide as vice president. If he's given the opportunity to become the president and to lead, he will be able to do more than just what he did as vice president. So I was enumerating out of the 36 policies that he has successfully championed by the directive of the President of the Republic to showcase how he will be able to solve problems, not to bring about problems. But in terms of social...
Yeah, but we'll come there. I want this to be about the audience, so it's just getting started. Please, a round of applause for Haruna starting the conversation. But I believe that Mustafa Bande, you've been listening in, and he says 36 policies rolled out by this government in a view that will help in terms of health, social protection, and livelihood empowerment. From the perspective of the NDC, do you have any alternatives?
If I will correct it, 36 policies introduced by Dr. Mahmoud Bawumia, championed by not Nana Addo Dankwa, just solely by the vice president. Yes.
Okay, yes.
Thank you very much. I think that thank the viewers for being here and our audience. Also thank Sen Ghana for taking to prioritize the understanding of our people as far as governance is concerned, because governance really is about the people. It's not about who is governing. He's defined democracy and all of that. For me, I think that democracy should really be what impacts in the life of the people. How do we raise the ones that are on the ground? The ones that are standing, how do we minimize our strength such that we are able to meet the classes of human existence to the barest minimum level where each group is living a very happy life. I'm here with some few people. The Deputy Secretary of UK Ireland Chapter, Isabella Dodson. And then I can see Gladys Iti, also from the UK Ireland Chapter. These are all people who have decided to come back home to be part of the process that would see a new government being birthed. Because President Akufo-Addo's 7.5 years have not been about the poor, have not been about the women, have not been about the children. It has been a small few powerful people who want to live their life happily at the expense of others. He spoke about Bawumia's achievement. I'm surprised why we will use this platform to talk about a mate who having got a portfolio in a government that we believe have messed the country. Dr. Mahmoud Bawumia says, I don't take responsibility from the people. I don't account to the people because I am a mate. I'm a vice president. The economy is broken, crashed.
I see.
And I cannot account to the people of Ghana for it because I'm a vice president. But here we sit, a political party is seeking to project the same man.
Okay, I see. That's their business, isn't it? So let's talk about the NDC and what you have to offer. This should be a brief statement so I can go to the other.
It's important that we
Yeah.
the foundation of this conversation. Because I don't see how in any conversation we should seek to isolate policies of a vice president from that of a government.
Okay, and that's why I want us to talk about the NDC and what you have to offer.
NDC have always been about the people. We have not been perfect when we're in power. Things have not been all that Ghanaians want because we keep growing, expectation increasing, population increasing, problems are increasing. But today, let every government want to look at the problem we have today. The number of women who don't have jobs, the number of children who are walking on the streets, the number of small-scale business owners who are losing capitals, the number of people who are even in the informal sector, say farming, who cannot even farm because of the cost of inputs today. The NDC is saying that, look, in terms of women, if I have, on the low scale, if I have a woman who sells porridge or wache or banku for other people to eat, if this woman is in business, she will employ at least 10 other people to help in the business. The problem of getting funding to run the business is what confronts this class of people. And so therefore, let us bring what we call women's bank. And this women's bank is not discriminatory, but it's supposed to cushion women who we believe are very vulnerable so that they can access these small-scale loans that will go into those businesses. Beyond that, it comes with service provision. It comes with service assistance where they are trained in terms of how to save. Now, when they save, they come into the banking sector. What is happening in the banking sector? But if you don't have a robust, regimented financial economic system, then you have a situation where these poor women will save their money in microfinances, will take their money to banks, and then one manager will squander the money and we'll be back to the conversation we're having today. So the NDC is about having a willful government that will stabilize, take responsibility of our financial system and make sure that it works for everybody. Where if you go and deposit 1,000 Ghana cedis from selling wache or porridge, you can have the guarantee that that money will be there, that bank will exist for a long time for you to have your money. You won't have a government coming and saying, I want to collapse all banks, let a few operate to protect class society. So that is one.
Yeah.
Number two, we are talking about youth. The greatest challenge we have in our society today is around the youth. And the youth, we're talking about people who cannot even access jobs for themselves.
Right.
The effect is that one, robbery is increasing, a lot of them are getting pregnant, a lot of young people are getting into vices.
Okay, so I guess what we'll have to do is to take a very short break now. And apologies, Mr. Fagbande, who's the Deputy General Secretary of the NDC. We'll come back to you because it's just getting started. If you're watching us, this is the Ghana Connect Town Hall. We're coming to you from the Presby Hall. We're taking a quick break. When we get back, then of course you'll be provided with the opportunity as our audience, both in the hall here and for those of you who are at home watching us, to share your concerns. Then we put that directly to the political parties. Of course, we have here Haruna Mohammed, who's the Deputy General Secretary of the NPP, and Mustafa Gbande, who's equally the Deputy General Secretary for the National Democratic Congress. I've heard the Women's Development Bank, the drone delivery program. These are all issues that we'll be interrogating, but we'll be back after this. Please stay. Directly with the political parties. What would you want to see going into the 2024 general elections, and what are the key issues when it comes to health, social protection, and livelihood empowerment that you'd want the political parties to address directly in their policy document, the manifesto, going into the 2024 general elections? Big thanks to Sen Ghana for making this possible, and if you're in and around Osu, of course, you still have a few more hours to join us here at the Osu Presby Presby Hall. Then you can, of course, put your questions across. We are also providing you with that special opportunity to write to us. Of course, for those of you who are joining us virtually, watching us on social media, on Joy News, and other platforms, feel free to send across your comments, and we will indeed be happy to share them with Mustafa Gbande, who represents the National Democratic Congress as the Deputy General Secretary. Then we have Haruna Mohammed, who's the Deputy General Secretary of the the New Patriotic Party. Apologies. I almost made you an NDC member. Please, a round of applause for them once again as we proceed with our conversation. We were on Mustafa Gbande before the break. I'll get back to him because the conversation is just starting. What I want to do now is to give you the opportunity. Then we'll come back and start off with Mustafa Gbande. He would box all of that together. But I want us to segment the issues. We talk about health first, then we go into social protection, and we'll look at livelihood and empowerment. So in terms of health, of course, there are so many ranging issues. NHIS is there, concerns about delivery, the quality of it. What would you want to see going into the elections? Then we have the issues of health in terms of the COVID levy that we're paying. Some are asking that we have an emergency fund that will protect us in terms of all kinds of health emergencies. Even as we speak this morning, the World Health Organization is announcing to us that we are facing another health emergency, which is the mpox. So these are all issues that are coming up. How would you want that to be addressed? And what kind of policies would you want to see in the health sector? So we're starting off with health. If you have any questions directly to these two gentlemen, I'll plead with you to just move behind the audience. We have a microphone there. Kindly take your turn and just put across your concerns. What would you want to see in the manifestos of these two political parties? And then we'll be hearing from the NDC and the NPP. So it's now time for you, if you're in the audience, you have any questions for these individuals, please prepare. Just go behind the audience, and there's a microphone there where you can make your concerns heard. So we're doing that now. You can just go behind and then put across your question. There are so many issues that we're looking at today. We have all of the time for you. If you're in and around us, so you can also join us, and then we'll be happy to hear from you. We have a gentleman at the back. Kindly introduce yourself, and let's hear your concern.
Thank you. I am Odehe Nuete Kwajo. I would like to know from our gentlemen what the various parties are going to do in terms of health in the area of the numerous chiefs compounds that we have across the country. Some of the buildings are there, but health workers are not up to the number required to be working there. We have few chiefs compounds that are without a common generator, for example, or refrigerators. Not to talk about an ambulance that can take referrals to bigger hospitals. I just want them to tell me in terms of health issues, what are their plans concerning this. Okay,
your name again?
Odehe.
Odehe, the concern now is about the chiefs compounds, the structures. You're talking about
inadequate
workers in the facility, and also referrals to bigger hospitals.
Exactly.
Okay, so that will be addressed, and it's good that you're asking that question. Mustafa Gbande is here. I think that project started from their tenure, so then we'll get some more responses to that. But we're doing three at a time. So let me.
Their third one.
Okay.
Chiefs compounds.
We'll get into that precisely.
In the health sector,
I was expecting that reaction, so we'll get to it shortly. Thank you for asking that question.
Right. Thank you
your
very
name,
much.
Sir, and your question.
My name is Ampoma Isaac, and I'm a member of the Ghana Coalition of NGOs in Health, and I also work for Concerned Health Education Projects. I'm happy to meet the two leading political parties. My concerns are in twofold. One is about aging.
Sorry, take that again.
Aging. What plans do they have for elderly health? And tied to that is the LEAP project has identified what we call indigent. But you realize there is a lot more older people that are not covered by LEAP, either through their health or whatever, you know, their linkage. So what positive plans do they have to expand the LEAP? And
okay,
also
Isaac, if you don't mind, I would want us to do it one at a time. We're doing health now.
Right.
So let's deal with the concern you have about the elderly people.
That's right.
Right. Then we'll come to livelihood, empowerment, social protection. Then we deal with the LEAP program, because that's a whole conversation on its own. So Isaac, if you don't mind, I think we address that in the next round, so you can come again with the LEAP. Yes. So I'll take your question on the elderly or the aged and what policies these two political parties have. I've seen one on CHIPS compound, which of course the first person asked. Let's do the third question for the day. Yes.
Please, my name is John Coleman. Mine is not a question. It's just like what my brother said or my son said about the LEAP. Now the LEAP, if you see the amount that is paid to the elderly, or those who are disabled, is minimal. On top of that too, it is being paid 2 months. That is, if we are supposed to be paid August, September, we are not going to get anything unless October. And that amount you cannot even
pay what exactly, sir?
Somebody, according to the strength of the family or whatever it is.
Oh, okay, that's a LEAP. Okay.
Yeah, LEAP. Some are being paid 260. Some are being paid about 300 and what have you. But my concern is I'm putting to the various parties. What are we going to do? Especially the payment.
Okay.
1 month, 2 months. It's very, very, very
all right.
reasonable.
Thank you very much. So I see there's so much interest in the livelihood empowerment program. I wanted that to feature in the social protection aspect. So we'll deal with that, but your question is well noted. Let's do the very final one. I thought we would have been doing 3, but let's do one more, and then we come back onto the stage to deal with the concerns. Your name, sir, and kindly go ahead with your concerns.
Yeah, good morning. My name is Kwame Grundu, and I'm sure we all believe that in Ghana we have inadequate health facilities at the community and the national level. And then I understand now home health care is something that is becoming prominent, as well as telemedicine. So I want to find out, as political parties, what can they do to regulate home health care and telemedicine? And in the first place, do they accept home health care as a solution to the inadequate health infrastructure?
Okay, Kwame, we're grateful. So Kwame is wrapping that up for us, and 3 questions in all. We'll deal with LEAP later on, because we understand and agree with you, our audience, that this is starting off with the health sector. So the first question has to do with the CHIPS compound, structures, quality, and what we need to do to improve quality. Ode asked that question. So since we left off with you, Mustafa Agbande, let's start off with you then.
Okay, so Ode's question, the CHIP compounds project was actually started by the NDC. And the rationale behind it is to help the country gain accessibility to healthcare. We have places that you cannot travel to. When it rains, nurses cannot go. We've seen nurses being caught up by streams overflowing and all of that. So why don't we have, and you cannot go and put a hospital in a place where the income cannot service the hospital. So why don't we build CHIP compounds to service polio, to service kids, healthcare, to deal with all these diseases that comes up. Today, those CHIPS compounds have been abandoned. They are not being used. 2.
And when you say they are abandoned, are you saying that on fact you have evidence to prove what you're telling?
Anything that the NDC does, as soon as the NPP came to power, it's about the NDC and John Mahama. It has never been about Ghana. It has never been the issue that let us look at the people who are benefiting from these things so that we continue for the purposes of public service and accessibility to healthcare.
I get that.
So the NDC,
if granted that this has been abandoned, what is the alternative?
The NDC will always continue these projects when we come back. They will still be CHIP compounds, so that in my village, where we have 100 people in a community, they have a nurse who can attend to their first aid needs. Children are being born in those communities. They can have access to early childbirth care. They can have issues with care that prevents this polio and all attacks that affect our kids in the villages.
So his concern, one is about structure.
Yes.
Then you have the aspect of the workers, I believe.
Yes.
The workers as well.
You remember President Mahama initiated the abandonment and abolishment of nurses' allowance. The rationale was so that we can save money, increase the number of nurses that can be trained at a particular time, so that we don't go into, say, the budgetary constraints only can train 1,000 nurses, where we need 2,000 nurses. If we save that allowance, we'll train 2,000 nurses. Every village can have a nurse to go and man a CHIPS compound. At the same time, what the nurses do is that government gives them a loan whilst they are in school, so that when you start working, you pay back the loan. That was the rationale for that. And it is supposed to make sure that we're able to decentralize healthcare and make it very accessible to the ordinary Ghanaian who are disadvantaged and deprived. And so those policies will certainly be continued when the NDC is open. Look, recently, Global Fund is a donor to Ghana Health Services. Even when we are complaining about we don't have money and all of that, external shocks, Ukraine, COVID, and all of that, Global Funds donated medicines to the people of Ghana, but because of a bad government, they left it at Tema Harbour, and the medications got expired. These are dangerous people in power. If you go on that trajectory where a government does not realize the importance of some of these services and agent actions that are required to save lives, then we are in danger.
Okay, to summarize your solution and what you would be doing as a political party,
I've told you that we'll continue.
You continue the construction of the structures, and then you're coming back with the removal of quota when it comes to the nursing or the training, the nursing training.
No, I just explained the rationale, the policy framework, the linkages around. It will continue it. I mean, certainly. So Frederick talk about aging.
Okay, yeah. If you could just we'll get to the aging part. Let me ask Aruna to deal also with the CHIPS compound. Then we'll go to the.
I thought I would have finished. And
yeah, we'll come to the elderly. I want us to take it point by point. So on the issue of the CHIPS compounds, Haruna, your points on that?
Thank you, Bless.
Yes.
I think that the most essential part of his question was not about construction of CHIPS compounds, but the abandonment and non-usage of some of these facilities where essentially workers are inadequate or even non-existent. And then the second part of his question was about lack of refrigerations at these particular centers. And
also the health workers, yes.
Yes, so there was a third part of the conversation within his question. What I would have to say is that CHIPS compounds constructions have never been abandoned, not directly to him, but to correct my brother here. CHIPS compound system started somewhere in 1994, and I happens to have worked at the health administration for 3 years before exit to another institution. And this particular concept under President Kufuor continued, and more infrastructure was being developed and opened up to communities and villages who hitherto would have to go a longer distance to access healthcare services. Yes, workers at those particular CHIPS compounds are clearly being designed. From his question, I believe that we would call on and make input to the health directorate, the Ministry of Health, to take a stock of the health strength, the staff strength of all these particular CHIPS compounds, for us to be able to see where that staff has to be provided. Yes,
but in terms of policy,
I'm coming on there because he came on a question that is based on certain strands.
Right.
In terms of refrigeration, I know perhaps it's coming from the health sector. We all know the cold chain system within the health infrastructure is being run by the disease control at the health unit, that is the district health management unit, the DHMTs, where the cold system is being run. At the CHIPS compounds, some few systems of cold reserves are being used at those particular places, and that could be the cause of which refrigerators are not being provided more essentially to some of these particular CHIPS compounds. If it is so that necessary, I believe that as this is coming from the citizens of Ghana, government will essentially make sure that the health sector will take this particular
so policy again, policy-wise, you're going
in terms of policy.
Yes.
In terms of policy, health production, you know, we are the first government that has invested hugely on health infrastructure in Ghana since the inception of the Fourth Republic. We are the most government that has invested so much on health infrastructure in terms of the provision of district hospitals to districts that has no hospitals, in terms of completion of abandoned health infrastructure. I
get that. Well, that's your point, but the issue about policy and what you intend to do, because he has the concern. How would the NPP's manifesto deal with that specifically? I mean, you can box the two issues.
Yes, that's what I'm saying. In terms of the workers, we are going to take stock because we are the government. We have recruited so far about 187,000 of health professionals into health institutions where they work.
So you will take stock?
Yes, we will take stock.
That's your
and then
policy
recruitment
approach.
will be done and sent to some of these particular places. And in terms of the refrigeration is asked, I've also given a response to that where the cold chain system is being run. By the Minister of Health, if it is so critical that refrigerators should be provided to this particular CHIPS compounds, that should be done through the Minister of Health, direct to the Ghana Health Services.
So will that feature in your manifesto? Because you seem to be talking
health
about what's
is one of the essentials, and I've told you that
specifically to his concern.
Yes, that's what I've addressed. Bless, if you give me the opportunity.
No, I get it. Because
I'm answering.
You seem to be talking about the Ghana Health Service. We want to know what your manifesto will
Our
do
manifesto
about it.
is so critical on the provision of health services to the citizens of Ghana. And that is what we are going to focus on, to ensure that infrastructure is provided, to ensure that health personnel are being sent, to ensure that health institutions will get the needed support to be able to, to recruit and then train nurses. Let me put it on record. Every institution has a capacity of what you take. That is why even in production management, with what we call design capacity and utilization capacity, there has not been any cap in terms of putting people into the educational institutions in terms of
I was just about to go
so
there.
There is no cap in there. It is the capacity of the school.
I was
even
about
as
to
a
go
human
there.
being, if you are taking water or you are eating, your capacity to eat must leave a space for breathing. And that is why we have design capacity and utilization capacity.
Haruna Mohammed, thank you so much. Also to remind all of you who are watching us on the Joy News channel that this is the Ghana Connect Townhall. It's the Citizens Manifesto. You have the opportunity today to share your concerns, directly interface with the political parties. My audience have been helping us, put up the questions. And I see so many issues come up. So the next round will be coming up shortly. So please prepare. If you have anything on health, you could go right behind the audience and then you can share your concerns as well. So we'll come to you shortly while we address the issue about the elderly people. And even before the elderly people, just briefly for the two of you, back to Mustafa again before I come to you, Haruna. I see that the issue about the quota for our training institutions is becoming a big deal for all of you. And thank you, the name again is Ode, for asking that question, because in the run-up to the 2016 election, that was a topical issue. What do we do with our health trainees? Are we paying them allowances or removing the quota system? So in terms of policy-wise, I mean, you were justifying that, but I didn't get any clear timelines or perhaps what the NDC plans to do on the quota system. Are you totally taking that out, or you're scrapping the allowances, yet you're taking the quota off again? What do you plan to do?
So with the issue of quota, which runs up to chip compounds question and abandonment and refrigerators, it's all about commitment of government. If the government doesn't have commitment to give those chips compounds the needed logistics and resources they need, you'll be back to square one. The nurses will go sit there 24 hours and do nothing. They cannot manufacture the medicines themselves. They cannot provide the fridges themselves. It's about the will of government to take responsibility of the underprivileged and deal with that. So with the issue of the quota system, it's about making sure that each corner of this country has accessibility to healthcare. And the NDC has a track record in that. Whilst we're building hospitals in the cities, we're expanding cheap compounds. We left government, they came and they abandoned. They have dreamt over it. They said they have invested hugely into healthcare. All of the people sitting here are from communities. You see the hospitals, La Hospital is just here, they haven't built it. They said they have building Agenda 111. Only God knows where the hospitals are located. But I'm saying that in case, by the grace of God, the NDC comes back to power, our focus is to expand the cheap compounds so that our children who are being born in the villages can get access to
clear measure on the quota system. That's what I want to get your policy measure on. The quota system,
we have always held that. Instead of sticking to allowance for few, let us train more nurses so that they will be able to give access to healthcare to our people. If that is feasible, you will see it in the next 24th manifesto that the NDC will be launching. And so clearly, we have a policy in terms of health expansion. Two, we have a policy in terms of being able to give human resource, trained human resource to these institutions, whereas we continue to grow the peri-urban and city health infrastructure.
So the NDC's position is much more in terms of policy about expansion.
Yes.
Expansion. Haruna, you disagree on that?
In terms of hours, you see, in terms of health delivery systems, we are unmatched when it comes to health delivery systems. The notion that hospitals that has been started by them has been abandoned is not true. Take your cameras today, move to Tepa, go to Kumeu, go to Konongo, you check all these particular hospitals that was initiated under the NDC, has been completed and being utilized by those particular communities. We are making sure, if you are talking about expansion, the biggest expansion is under this NPP government. The biggest expansion.
In terms of human resource?
In terms of human resource, we have recruited more health professionals. As we said, 15,000 of health professionals up to the level of 2022 has been given access to apply to be recruited into the health delivery, into the health.
Yeah, but the system the system was frozen for a while. You agree?
It was frozen under them, when we lacked policy credibility before the IMF.
So what's your solution?
So we came in, we took the bold step to be able to get out of that particular IMF system, make sure we open up from those backlog of nurses that were not being recruited from 2012, and then we recruited them. Today, the opening up of the applications for people to apply stood at 2022. And we are giving access to 15,000 nurses to apply.
But 15,000, you agree, is just a drop in the ocean?
No, not drop in the ocean.
I mean, compared to the numbers out there.
We started in 2017. We've opened several.
But I'm telling you, what's the plan? Let's talk about the plan, because he seems to put out a plan, right?
Yes.
The plan is expand training, take away, some sort of allowances at the training level. Then you use that funding to build more hospitals for people to go into to work. What's your plan as the New Patriotic Party then?
For us, we are going to maintain the allowances of the nurses. We will continue to leverage resources as inspired by His Excellency the Vice President, that we are going to leverage resources to the private sector. Allow the private sector to be able to construct hostels, allow them to be able to construct additional health facilities, allow them to develop, and government will leverage the resources that we would have used to do this particular construction for wealth creation and to be able to assist the Ghanaian citizens in other sectors. Because we have done so much in providing infrastructure in these particular sectors, it is time for us to be able to leverage these resources to the private sector. So we will maintain the allowances of the teachers, we will maintain the allowances of the nurses. And mind you, it is a mark of dishonesty You took away their allowances. Go to Tamale College of Education. How many infrastructure was built in there? Nothing of that sort. Not
and that's
even
why
a
he's
block.
also challenging
So you took away an allowance and you could not do what you are talking about.
That's why he's
and
also
then you are coming back to tell them that you are taking it away and you are going to build more infrastructure.
And I guess
by the time you will come, all districts in Ghana will have a hospital.
Haruna, thank you.
That is what is going to happen.
And that's why he's also challenging you to the Agenda 111 and how many facilities you have been able to complete ever since. The government structure platform tells us clearly that you are at various stages of completion. At least that's what your system says, not 100% completion for any of them. So that's a matter of fact.
So far. That one is a fact.
That's a matter of fact. So,
but some have been 80, 90%. Complete.
Okay, so let's deal with the issue of the elderly people and home care, because that was the critical question that Isaac puts across. Then we'll give the opportunity to our audience again to come through with another round of questioning. But if you're watching us from home and joining us, this is the Ghana Connect Townhall. My name is Blessed Sugai, and of course, feel free to share your concerns with us via all of our social media handles on X, on Joy News, on Facebook, and we'll put that across to, of course, the political parties representing us here. But we've been focusing on health. We'll go into social protection so far because that's where another controversy is. We'll get there. But let's go to the elderly healthcare system, Mustafa.
I want to thank Frederick for this very sensitive question, because if you look at our audience, most of them are elderly. And so, first of all, we'll all get old one day. And the way we treat our parents, our grandparents, will show how we will be treated when we get old. If we pay lip service to the aged, we'll pass through. President Akufo-Addo is 80 years today. He will soon join our grandparents who cannot walk, and he will feel it. Now, if you look at healthcare, in the health insurance scheme, for example, we have a pact for young people, children, and then we have a pack for working class, and then we have a pack for the aged. Today, the health insurance service have collapsed. Go to the hospitals, your audience will tell you. So my grandmother sitting there will go to the hospital, he won't get health care because he doesn't have the money. The dependents who are workers, all right, who would have ensured that every Monday or a Friday, I'm able to put my grandmother in a wheelchair, drive her in a car, or get her to a hospital for healthcare. If you go to the hospitals, there's traffic there. People cannot even get beds to sleep. Okay, people cannot even get wheelchairs. The treatment systems are not just working under this government. So therefore, the question is, where do we start from? Let's build a society where each and everyone that has a dependent is prospering. A working class is doing well. If the working class is doing well, government intervention, build health institutions, train health professionals, put in the system that would reduce the burdens of the people. Make sure health insurance is working. Let them go to the hospital, get treated and get medications. We won't be having a special package for aged to say either they are going to hospital or not. That is another conversation. Even in private sector, where you will boost private sector to build private hospitals where you extend services to these aged in their homes. Taxes, you cannot even establish a company.
Mustafa, apologies. Mustafa, the point about the solution, the policy,
that's why
what we need.
We are tackling issues of job creation and poverty head on. We create systems that will create jobs. 24-hour economy will create jobs. Make sure that Ghanaians pay less tax. Today, do you know that if you are a government worker, about 30%, 25 to 30% of your salary go into taxes?
How does that deal with healthcare for elderly people?
That makes dependent people who have dependents. So the working class, it makes them stressed. They are financially stressed. So if you have 2 children and you have a grandmother in the house, your salary cannot take care of them, because the cost of living is very high. So if government take a deliberate, bold step to reduce cost of living, if you save 100 cedi from electricity, you save 100 cedi from water, that will be 200 cedis. You save that to take care of grandma. If you are able to buy provisions in the house at a lesser cost, okay, where in 2016 a tin of milk was 80 pesos, Today it is about 9 cities. If we're able to reverse the trend,
I see.
Then the person who is working to make sure that you service the home will save some money, take care of your children, take care of grandma, take care of your husband
made that
or mother.
pronouncement on the 24-hour economy. It appears that that's tilting more towards the private sector. So government's big spender has been compensation for public sector workers. So if I'm in the public sector, for instance, how do you reduce my spending? How will I be able to get more resources to take care of the elderly?
The 24-hour economy is not targeted at the private sector alone. We are saying that today, if you go to the government hospitals, they are working all right 24/7, but after 6 p.m., some services are closed to the public, except in the morning. So we are saying that let us recruit more health professionals, create jobs for Ghanaians, let us make sure that we expand infrastructure, let our health facilities work 24 hours on all services.
That's for hospitals. I'm talking about people in the public sector. I mean, the public sector, you agree, goes beyond the hospitals.
Yes, so I'm enumerating.
Yes.
If you go to Harbour today, they run 24 hours, but you cannot get all services at the Harbour 24 hours. So we are saying that let us have a policy where most Ghanaians are employed. First of all, would have provided for a job. My brother who is sitting on the street, have completed university, he doesn't have a job, would have gotten a job, right? 2, services, people who import would have had the opportunity to clear. So 24-hour economy is not about private sector. If you go to banking will do 24
we're
hours.
relating that, and I get that clearly. We'll come to the aspect of livelihood empowerment, but we're relating that, and you brought up the point, relating it to healthcare and more spending space or disposable income for people who would benefit from that 24-hour economy. If I work, for instance, at the Ministry of Local Government, for instance, you don't expect me to work 24 hours?
I wouldn't expect you to work 24 hours, but I would certainly expect a government that will make things easy for you so that you can save some money to take care of your household.
Okay. Right. The issue about developing a whole home care system, that was a second component of the question. And before I come to...
so I haven't seen that, but I think that with the information I have, perhaps there's more to it about home care. But what I do know is that the NDC will certainly try to ease congestion as far as health service provision is concerned, make it accessible to all Ghanaians, make sure that if you have to save money in your pocket, then you can take care of your dependents. 2, if government makes it possible for health institutions to provide adequate services of health to our people, then of course it can be assessed. If health insurance is properly working, we'll not have a conversation where the aged are not being taken care of, because the aged must go to the hospital, pay attention to them. But where we have deficit in terms of even infrastructure, consumables, they don't have. Beds are not there. 7 years. How many people have died out of this negligence? 7 good years. The government didn't have a will to deal with these things. Even when we are hit by external shocks like COVID, political functionaries, through the aid of government functionaries, still chop the money that is meant to ease some of these things. And for NDC, we didn't do that. We'll never do that to the people of Ghana.
Haruna, let me come to you on the issue about the elderly. Then we'll take another round of questions. So please prepare if you have another question. Yes.
Thank you very much. I think that provision of healthcare services to the elderly is very essential. And I'm happy that he has alluded to the fact that the health insurance scheme has so divided the provision to the elderly, the children, and the middle age, which is a straightforward policy that came from the NPP, a very party that he seeks to lampoon, has been the party that has brought this particular services
President
to the
Kufuor
people.
brought it.
President Kufuor did not come from the NDC.
Not President Kufuor.
I'm telling you, President Kufuor did not come from the NDC.
Let's make progress.
People have died because you abandoned it.
When President Kufuor did so and you came, and health insurance, when you get up, you go to any hospital that you so desire to go and seek for health care. You brought what we call the capitation. You want the elderly to assign himself to one hospital, let's say La General Hospital. If he's sick and he's in Yendi, he has to be transported from Yendi to La General Hospital to be treated. That was the policy you brought, capitation.
That is a lie.
That was what you brought.
In fact, so I recall President Mahama, you know, and Harun, I'll give you the time to just, but sorry to chip in. Former President John Dramani Mahama, who's now the candidate of the NDC, has sought to provide his perspective on that. He says, when you started rolling out that insurance policy, it was localized. I recall that was the point, that it was
where is help provided?
He just lied.
Where is help provided? Yeah, President Mahama walked out of parliament when we were even implementing the first health insurance. He was a member of parliament.
Okay.
He was a member of parliament. He walked out that health insurance should not be provided to the good citizens of Ghana. He never voted on it. He never accepted the concept.
So the policy then of improving it, tackling issues about the elderly, yes.
Yes. So I am happy that the health insurance has become a center stage of their policy, talking about how it is being provided. One, to provide health care to the elderly, we need to have availability of hospitals. And then access is also something that is very important. We are going to work on to make sure that all the Agenda 111 that we have put across, which are at various stages of completion, would be completed to accommodate this health need of the elderly. Second, you have just seen that this dialysis centers and what have you has been empowered and supported to be given. And mostly, our elderly people are mostly affected by some of these particular chronic diseases. So they would be given some particular incentive continuously, because we have done so in the dialysis sector. The health of the elderly is so important to the NPP's government, to the stage that we need to make the health facilities available at first stage. Also checking on the health insurance. Under Dr. Okuboy, we have also made other essential service provisions under the health insurance to be provided to the elderly who will be seeking health services. So when we come, we are going to further look at the impact of these particular services that we have put through. We also assess the health need of the elderly, and will provide a direct service to the elderly in terms of what affects them most and what will also enhance productivity in terms of the elderly support to the development of our nation. And if you check the COVID when it came, today we have a facility that is being constructed to support vaccine productions and what have you in the Greater Accra region. We have done so, and specialized hospital facilities has been developed. And this is just to enhance the health needs of the Ghanaian citizen. And everybody, all of us here, will grow old. And we all support our elderly to be able to ferry us to a certain level that we can stand on our own.
Okay, a round of applause for them, please, as we go to the next round. So if you have any question to ask again, please go, behind the audience. We have a microphone there. You can feel free and ask your questions. So we'll be doing that in the next minute. Please go behind and put across your question. But for those of you who are watching us at home, this is the Joy News channel, your election headquarters. We're bringing you the Ghana Connect Townhall, where you have the opportunity. We're calling it the Citizens Manifesto, for you to put across your concerns. A number of them we've dealt with: the CHIPS compound, the elderly people, health insurance, for instance. What more do you have to ask? Feel free to put that across on the Joy News channel, on all of our social media handles, and we'll be right here to deal with them for you. But I want us to go back to the audience now, because a number of concerns emerging. Let's round off on this health sector, because we also agree that we need to deal with social protection and then livelihood empowerment. I see some people talking about LEAP already. We'll talk about LEAP shortly, but let's round it all up in terms of the health sector. Your name, kindly introduce your name, sir. Introduce yourself, sir, and then let us know what your concern is. What would you want to see in this manifesto when it comes to health?
Yeah, my name is Nene Nwete Opata. I'm only concerned about facilities at the hospitals. I think early this year or last year, getting to early this year, I had a friend who was sick, and he has to rush to the hospital. And he closed from work on Monday went to the hospital that very evening, that Monday evening, just for a checkup. When he went there, the doctors says that they would like to give him further examination. So he was admitted that night. Then the following morning, Tuesday, he went into coma. Then the doctors realized that they cannot treat him at that particular hospital. So they have to refer him to Kolebu. When they call Kolebu, Kolebu says they don't have any facility to admit him. They call Accra Regional Hospital. They also say they don't have facility to admit him. 37, they also say the same. So the doctors over there became so frustrated. They don't know what to do because of just common admission of a bed that will be provided for that, my brother. And lo and behold, they have to now looking elsewhere. So they begin falling on private hospitals to find out if there will be any available space or chance that the person, my brother, could be admitted. So the Port Clinic at Tema was so good to admit that. Now, my question is that, and the end result was that even when he was admitted at Port Clinic and they sent him there, I don't know whether because of the delayed or whatever, my brother passed on the Wednesday morning. So you can imagine the time that the sickness started and the time that this thing could have was ended, and then we lost the person.
Nene, you were about to ask the question again.
My question is, up till now that we have had our governments in a system for so long, what are we doing to providing facilities like beds, common beds for our patients to be admitted at the hospitals? Because a whole hospital like Kolebu could be short of beds, which is something that I'm so much worried about.
Right.
And 37, Accra Regional Hospital, a big hospital like that, could have such a problem.
Okay.
You know.
And then we're assuming that all of the concerns you're raising and the claims you're making about these health facilities are true, but to be fair to them as well, they're not here to respond. It just reminds me of this conversation that we've had before, the no-bed syndrome, I recall. I don't know if that's what is happening now, but this is a lived experience as Nene is sharing with us. So we're taking his lived experience and putting that before you, the political parties, to share what kind of solutions you do in terms of tackling the health facilities and the quality of services that we see there. Let's move to the next person. Please introduce yourself, tell us where you're coming from, and what's your concern? What would you want to see in terms of healthcare? Yes.
Well, my name is Isaac Saka, and I'm grateful to Send Ghana for organizing this forum for us to have face-to-face interaction with our political party heads. Now, the first question I would like to ask is, NHIO faces a lot of challenge, all because their funding has been capped, and most of the funds goes into the consolidated fund. Now, I want to ask, are they willing to uncap this funding so that the funding goes directly into the NHIO funding? Then the second aspect is mental health. Little attention has been given to mental health. Are they ready to incorporate it into the primary healthcare system where mental health will be readily accessible in every part of the country? Thank you.
Well, thank you very much, Isaac. And of course, the health insurance, that's where we left off. So it's a good time to bring that conversation back. Of course, let's hear from the women as well. Good morning to you, madam. Kindly introduce yourself and let's hear the question. Yes.
Me paucha friend me Auntie Gladys. Me fi dodua and me san fi ningo pram. Now me concern is some years back no na ye me hu say ebi no ye HIV education wo villages no. That time no prevalence rate no aba form. For some time now ye nya sa adwuma no bio. Me hu say prevalence rate no e kosoro papa. Me bisa say eno no e de na ye wo ho. Afensu ye wo ye nuan mo bia ye training wo mu say models of hope. A omo wo facilities no. Na say obi ya diagnose no ene say owo HIV a ye di masa akrofo no na ye di wo mu kasa. Matia says, Sacrophone, Yentia or Muka, Sacrophone so. Because me who say ya mu ye juma papa.
Okay. Auntie Gladys, it's just unfortunate that, of course, you're speaking to an Igbo man, so I don't know how we'll do that, but I'll try the translation. And she's talking about the... Okay, you understand perfectly. Okay, that's great. But for the sake of our audience, Auntie Gladys is talking about the HIV... and Haruna help me out on the education, right? Yeah, and then the prevalence rate, how we can tackle all of that. And probably we might want to respond to her in three, so she's able to, of course, understand what position you have and how you intend to solve that problem. But for those of you who are watching us at home, you also have the opportunity to ask the question. So yes, it's a good time to be sending them across while we take them all at once. We're talking health now. Let's go to the next question. Please introduce yourself and what's your concern. What would you want to see in the manifesto?
Good morning. I'm Nana Ayakiyochu, Queen Mother from Dodowa. There's a saying that wealth is health, or health is wealth. But now, if you don't have wealth, you don't have health. We are using national health insurance. That is the minimum or the lowest insurance that an average Ghanaian can assign on. Yet when we go to hospital with it, we pay. The tariffs of NHIS has been reviewed. It's still low.
What percentage would you want to see then? I guess it's 2.5 now or more? What percentage point would you want to see, yes, in terms of the allocation? Do you have any figure in mind where you would want it to increase to?
I don't have a figure.
Okay.
But my question is, why have they not looked at the premium we pay? So that if it is the premium that is causing the low tariff, then you review it. Because we have insurance, yet when you go to the hospital, you come home with a lot of receipts, like a cash patient. So my question is, why are they not looking at the premium that we pay, if that is what will solve the problem?
Okay, thank you so much. And we're grateful that you're putting across this very important question. The issue about paying realistic fees so we can get the quality we want for national health scheme. National Health Insurance Scheme. Let's do one more, then we'll wrap it all up for health, then we can move to other sectors. Please introduce yourself. What would you want to see in the manifestos of these political parties going into the 2024 elections?
Thank you. I am Jane Amele Uku from Janock Foundation. I work with St. Ghana. COVID-19 took us by surprise. We were not prepared as a nation. And you know, epidemics go by immunization. How prepared are we in case there is any other epidemic on the way? How are we prepared to finance such epidemics? And as an advocate, we are also advocating that government should establish a public health emergency fund to take care of these things. Can they promise doing something like that? Thank you.
A commitment you want. Please give it up to her, because she wants the political parties to commit to an emergency health fund. I was just talking about the health emergency declared today by the World Health Organization on Mpox, for instance. That's just giving us a sense of what we need to do, how prepared we have to be as a country, and what mechanisms we can put in place to address these emergencies when they emerge. I know of the COVID-19 levy, which many were asking why we're still paying that even post-COVID. The sustainable way for some people is to go with an emergency health fund. So let me just take your commitments on that briefly, then I segment out the issues, then we deal with them. Mustafa, are we going to see anything in that regard from the NDC, an emergency health fund? Yeah.
I would have been very much happier. You know, we are still paying the COVID fund, the COVID levy. If you go to Kozuka International Airport, any traveler that comes to Ghana pay a COVID levy. You know where it goes to? It goes to a Nigerian in partnership with this government. It doesn't go to the ordinary Ghanaian. We've made over 84 million, 87 million dollars from that tax.
Right.
Government of Ghana got not less than 9 million. So if all these monies had been pushed into a health emergency fund with a disciplined, committed government, we'll not have another COVID where government officials have mismanaged and chopped COVID money.
So the question is the NDC committing to the establishment of that fund?
In this whole conversation, you've seen our commitment in terms of healthcare transformation. We will not only establish, and I'll check with my leader, the flag bearer, if this is not in our manifesto, I'll speak wisdom to carry this on behalf of the people of Ghana.
So we're not definite that the NDC will establish this in your manifesto.
We'll get there. Not just that. We should have a government that will clean up the health care system.
Yeah, but I'm talking about, we're specific. She wanted to see a commitment. Are you committing to
I
it?
commit.
Okay.
I commit,
right,
subject to a conversation with the leadership of the party.
Okay, so you're successful.
And the flag
Please, a round of applause for
that will be done.
Mustafa Gbande. He's committed.
That will be done.
I'll take one more question, but sir, just hold on for me. Let me take the commitment also of Haruna Mohammed on that, to see if we would see that commitment from the NPP
I think
going into the elections.
Public health is one of the important aspects that every government would wish to champion, and the NPP is always committed to making sure that public health is being catered for. We have demonstrated that through the provision of specialized health infrastructure in terms of the sickle cell and blood center that we have put up at CAF. We have also demonstrated that by looking at the mother and care unit at CAF. We've demonstrated that by the rehabilitation of the Obuasi Center for. These are special health units, including the vaccine center, where we never know when we will be faced with such challenges. And I want to commend our mother from St. Ghana for asking us as political parties who are the forbearers of these particular policies that we put out to commit ourselves. And we have demonstrated
particularly to the Health Emergency Fund. Is the NPP going to feature that?
Sure, because I am telling you what we have done. So we are committed to any public health provision, and we are committed to such emergencies where we'll be able to provide essential services. And we have demonstrated same when we were met with COVID, what we have been able to do and the provisions.
So that's good news. The two political parties have committed to that. Please give it up.
No, but
I see.
But just to say this, they are currently in government.
Very briefly. So
and that's why I mentioned what we are doing.
Okay.
That's why we are doing.
There shouldn't be a platform for another litany of promises.
So they should do it now.
Government, do it now.
You wanted to do
it.
But we're talking about the manifesto.
You are aware of the treatment and quarantine facility. You are aware of the treatment and quarantine facility.
Gentlemen, just hold on for me. I know this is what you do, but it's time for us to hear
have so many of them
more of our citizenry on what they plan to do.
Central people, they don't deserve
Haruna, let's take the question.
No, but
and then
this is questionable. When we say CAF and you say in Ashanti region, they don't deserve support.
I'll come back to you. There's someone with a special need in our midst, in the audience today, that I want us to listen to. Sir, what's your story? And Haruna, I'll give you the opportunity, gentlemen. What's your story, sir? What would you want to see in this manifesto? And particularly because of your needs, just itemize them so we can put them to the political parties.
Good morning. My name is Elvis Alipui. To the two parties, everyone is talking big. That I've done this. When I come, I'll do this. For we, the person with disability, we did not enjoy the health system well. Because when you go to our hospitals from south to north, when I take one side of our disability, which is the hearing impaired people, there are no sign language interpreters in the hospitals. So how do they benefit someone who cannot hear well? And in our side, I'm in a wheelchair, as we all can see. We go to hospitals, because someone say already that is an advocate. I'm also an advocate. You go, your wheelchair cannot access the room to some of the doctor's table. To the two parties, I want them to tell me something about that one, so that when they come to power, we hold them accountable. I disagree with the conversation there because we don't have good health facilities and a good health system. Otherwise, our big men cannot be going to abroad and go and treat themselves. Like recently, Abangbagwe was, I just want to mention him in abroad last time for treatment. Why Ghana health facility cannot treat him if we have a good health system? So I want the clarification on that.
All right. Thank you so much for putting that across. Of course, we'll get them to tell you what they have in mind. But it's also a good time for us to just move straight into social protection. Then we box up the issues because we also have time to work with. So if you have any question when it comes to social protection, of course, many of you started off by talking about the Livelihood Empowerment Program, the LEAD program. We know that at least there's some increment in terms of the stipends that are being paid. But what more policies would you want to see towards that going into the elections? There's the issue about school feeding, which is a key issue for schools in rural communities. Your concerns about that as well, let's hear them out. So just go behind the audience if you have any question, and I think, Ode, you're asking a question about livelihood empowerment. Okay, maybe we'll just take that at once. But if you have any concern, any question when it comes to social protection, this is the time to ask that question. On school feeding, we have issues about child protection. I was talking about the LEAP, for instance. Then we'll wrap up with issues of gender and then livelihood empowerment. I guess that's where the economy will also feature in a bit. So just before I come back to the political parties, I see someone in the queue already. Please introduce yourself. Tell us what your concern is.
But Blessed, when it comes to questions.
Yeah, I know. We'll just do all of that together. I'll segment them, and then yes, we'll deal with that. So I want them to ask the question, then we'll put everything together and move forward. Sir, your name and what's your concern when it comes to social protection? What would you want to see?
I understand part of the District Assembly Common Fund is for fiscally challenged people. Most of them are found on the street competing with trotros and motorists, or other motorists. I want to know what social welfare is doing about this, since we know that this Assembly Common Fund is supposed to at least give them something to keep them out of the roads. So I want to know exactly what the two parties are going to do to make sure that those who brings them from the villages, are dealt with. And also, the District Assembly should make sure that those people who collect the monies or the tokens or the stipends from them should not go also to the street to beg. I want to know what they have for such. Okay, so allocation to persons with disability when it comes to the District Assembly Common Fund. Yes. Your question, correct? Okay. Let's do the next question on social protection. Kindly introduce yourself and let's hear you.
Thank you. Good morning, and thank you to our two political parties. My name is Isabella Dietzen. I just want a very quick definition from the two parties what social protection and livelihood and empowerment mean to the two political parties and how it is being outlined in the policies. We wanted a bit of a breakdown because I do appreciate the good work each or intentions they have, but to the ordinary Ghanaian, please let's break it down to the understanding. Thank you.
Yeah, thank you. A very critical question because the political parties argue a lot about social protection. Some say they've done more social interventions than the other. And that's stoking a lot of debate. Haruna is here, so we'll get into that shortly. Your question, what would you want to see in the manifesto? Introduce yourself while you do that for us, please.
I am Jane Amele Oku again. The school feeding. You all agree with me that an egg costs 3 cedis. And the school feeding, the amount that is given for the people who are providing food is 1 cedi 20 pesos.
How much? 1 cedi?
1 cedi 20 pesos.
For the entire course, or this is
for a child?
A meal, yes, per meal,
yes.
Okay.
For a unit or one person.
Right.
That is what is paid to the cookers. How are they going to increase this money? Because an egg, just one, costs 3 cedis. And a whole meal is paid 1 cedi 20 pesos with taxes. Both parties, let us hear you. Thank you.
In terms of the allocation, yeah, and we all agree that 1 cedi 20 pesos obviously is insufficient. And I'm just wondering what kind of a meal we can prepare with that. But of course, I'll leave that to the political parties. Let's see what plan they have for school feeding, because it's a big deal. But since we're moving into social protection, it ties into questions around NHIS, the issues surrounding premium payments and all of that. We'll box that into social protection and start off by defining it first of all, because that's a critical question that's been asked about what social protection means to you, the two main political parties, and what we're likely to see this year. But let's cap it all up. Let's do the last question, the last concern, and then we move on.
Okay, thank you very much. My name is Kunedu Asiedo, and I work with the Ghana CSO's platform on SDGs. Now, I thank Mr. Elvis for highlighting some of the challenges of people with disabilities as they access health services. My concern is that for the past 8 or so years, there's been a disability bill that has been walking around, moving to every office to get it passed as we speak. There's been 2 validations. A whole working group has been set up to make sure that the bill gets passed. There's been a parliamentary caucus that was just inaugurated about 3 weeks ago. We are running out of time, because if we miss this golden opportunity of having the bill passed, we will have to start the cycle all over again. It is expensive, it is frustrating. People with disabilities are missing out on their rights, simple human rights. What are the political parties committing to? I'll be happy if the NPP speaker is able to also commit that when he leaves here, he will make sure that that document gets to cabinet, gets to the floor of parliament, and gets passed under certificate of urgency. Okay. If they fail, can NDC say in the first 100 days we will get this bill passed? Thank you.
That's a nice way of holding people to ransom, isn't it? I see the nice move there. So you either get it passed or you're not getting my vote. I guess that's what she's trying to say. But let's see how that will unfold. It's great you're talking about the disability bill. So what I want us to do, because we just have 30 minutes to go, we'll segment this. Use 15 minutes to address the questions in thematic areas. That's what I'd appreciate that we do, because most of your questions are related. Then the next 15, we'll use it to wrap up. Of course, get back to you, talk about gender and inclusion as well. Then we can tie that into some more mop-up questions on livelihood empowerment. So the thematic areas I see so far is, first of all, social protection. We have what it means to you, the definition itself. Then we have the question on school feeding, 1 cedi 20 pesos, would you increase that? The question also around the District Assembly Common Fund, whether would, just increase the allocation to persons with disability and tie that into the disability bill. I guess that's also a component of it, trying as much as possible to promote inclusion. Then there were earlier questions about NHIL, which is a common frame topic that you can deal with, the issue about mental health, and then we'll wrap up with Auntie Gladys's question on HIV HIV and the prevalence rate and how to do it. So let's start off with social protection.
Okay.
Mustafa Gbande, what does social protection... It sounds like a social studies question, but yeah, we're back to the classroom again, isn't it? What does social protection mean, especially to you and the National Democratic Congress?
So for us in the NDC, we see social protection in a certain light. Now try and break it down.
Yep.
It's as if all of us are in a cycle, and government is at the center of the circle. In between, we are unequal. So we have people who are less privileged, we have people who are constrained, we have people who are poor, we have people who are old. At the other end, we also have people who are privileged. So some are children of ministers, some are children of businessmen, the private sector, some are children of presidents. The center is how do we distribute the nation's resources such that we are able to bridge the gap of inequality? How do we bring all of us to the table? One, from healthcare, two, from education, three, to even how we enforce and govern ourselves. Then four, how comfortable does each of these categories get to live in the country as far as the rules of government is concerned?
It's good that you're setting your own yardstick. Yes. So going by that.
So for
going
us,
by that.
For
yes,
us.
going by that. And we don't have to go into
for us,
nitty-gritty.
health insurance has always been a good policy.
Yes.
It has, like I said previously, and to add, it also has a pack for disability.
I see.
Because then you don't have to pay premium. Government takes care of the premium. And then you have to pay administrative cost. The same thing happens to children, the same thing with the aged. Today it has collapsed. When we come to power, we'll make sure that health insurance, which is the medium for my poor mother to go and seek medical care, would be made to function properly, so that I don't have to give her money. Government will take care of her.
Okay. Then there's because that's
provision
specific
of health infrastructure.
Yeah.
They've talked about it. Today, you don't even have access to health infrastructure.
I get that. But
Look,
Mustafa,
the people of Dambai are watching me.
Yeah, but I want
last month, I just want to say something.
Okay, just last month, because
last month, if you went to Dambai, Karachi is where President Akufo-Addo have made a regional capital. The quadrant and area that they are building a hospital. Last 3 days when I came back from there, that thing has been removed.
Okay, I see.
And the land is bare. So when they say they are building hospitals, and Ghanaians are sitting here and cannot pinpoint where the hospital is being built, when they say that there's deplorable health care, and people are suffering, and they say that they are providing.
I get the concern, but let's tie that.
Global Fund, which is a partner in dealing with the HIV issue,
you've made that point.
Which
I want us to...
Global Fund is being mismanaged by government in bad faith,
so
to the extent that drugs are expiring.
So let's
Ghanaians should be concerned.
Yeah, let's
that the people
that.
of this country should know that you don't have a government that is responsible.
That's why we want to know what your manifesto is offering. So on the disability bill, what are you doing specifically? On the District Assembly Common Fund allocation to the physically challenged, what are you doing?
These are all things that are existing. Look, this government doesn't pay Common Fund. How would you get your allocation? Go and ask the MPs. They don't pay Common Fund to the MPs. They don't pay Common Fund to the assemblies.
But what
the most broke departments of government today are the assemblies. Ask him. Why have they not been paying?
That question is fair, but so, let's also move forward. Let's talk about what you plan
to do. Commitment. Our plan is to continue what is existing. Our plan is to be able to deal with what we already have. You have a government that is responsible for all of us. They are in government and they are not doing it.
I get that.
We can't reinvent new plans.
Your manifesto said.
No, it's not about manifesto. It's about what we have and what is being done about it.
This is about the people.
He's sitting here giving promises. We have Common Fund scheme. Why are they not paying? If they were paying Common Fund to the assemblies, the disability will be catered for. These assemblies will construct hospital, toilet facilities. They will do roads. Recently, they brought machines to Independence Square here. Did a whole ceremony of commissioning. What happened to the other set of the local the Common Fund? Should we go and say that we are putting another fund for local? No, it's not possible. Hold them responsible.
Let's not be all over the place. Let's be specific on the questions that are coming through.
The question is about
the allocation, yes, to physically challenged people.
I'm saying that they don't pay it. It's existing. So no government should reinvent.
But there's a constitutional allocation, for instance, when it comes to the district assembly common fund.
Yeah, they don't pay.
Is that enough? What policy do you have? How would you tackle that? Are we going to see more allocation? What do you intend to do?
When we were in government,
briefly,
if you recall, the disability were pushed to be the ones manning our road tolls, our toll booths. The disability decks were the one managing it. It took one minister, President Akufo-Addo's cousin, to abolish those.
Will you revive it?
We'll revive it. You will revive it.
Let's go then to school feeding.
Thank God the Minister of Finance under them is now saying that they are bringing it back. At least it will provide jobs for the disability. They collapse it.
I see. Let's go to school feeding now.
School feeding.
1 cedi 20 pesos.
School feeding today, it is not about the 1 cedi 20 pesos. It's about a centralized system of managing the school feeding program. Our children are facing a danger of malnutrition in the name of free senior high school. As we speak today, Buffer Stock is doing free school feeding. If you go to the Minister of Education Secretariat, they have free senior high school secretariat. They are doing free school feeding. Please, disgruntled nature. Everybody is doing what? It has become a Ponzi scheme. Let us do it the way we want. No control, lack of discipline. If we come to power, President Mahama have spoken about it. Let us have again our centralized system. You remember when they fought about appointment of who becomes school feeding coordinator, and somebody will have to go and sit in abroad for years only to come back. No punishment. Now this government doesn't have commitment.
I see. Now the premium on NHIL?
The premium on NHIS would always have to be paid. And I have worked at health insurance before.
Okay.
And if you go to health insurance, when an agent above 70 comes to a health insurance office, he is supposed to pay just something small for administrative expense. The only people who pay are those from, I think, after 18 to 65 or 69. From 70, you don't pay. When you are a disability person, you are captured as an indigent and you don't have to pay premium. The problem is not whether or not we pay premium or whether or not we don't pay. The problem is that the central management of the health insurance system is collapsed.
All right. Final one.
Medical facilities provide bills back to health insurance. The claims are not being paid.
I see.
Hospitals are collapsing as a result of that. Go and check the debt that is existing today because people have gone to hospitals. They've taken health care. Government is not paying the health facilities. How will they continue to take care of the people?
Do we increase the premium or not?
We don't have to miss the premium.
Okay.
We have to pay premium.
Well, okay. Right.
The Ghanaians are not complaining about premium. They are complaining about the functionability of the facility.
What's the NDC committing to? Paying more?
The NDC will not scrap premium. Will pay premium, but health insurance will be back again for all Ghanaians to access health care.
Some clarity then. Then finally on the no bed syndrome.
No what?
No bed syndrome. Nene Opata asked the question.
No bed syndrome, I presume, have always existed, but under our government, when President Mahama was in power, it was minimal. In the last 7.5 years, this government have not provided a single bed, apart from the children's ward built by the First Lady in Kumasi.
Okay.
All right? So therefore, it is about a will, it's about commitment. If the government is not committed to public service, it wouldn't do it.
All right, let's come to Haruna.
That is why you need a committed government, a government that walk its talk, not a government that in the middle of accountability, they begin to share responsibilities as to who is responsible and who is not.
Haruna, let's hear from you. Premiums, increase them or not?
I think that for us to increase premium, we have to look at the feasibility of that and make an impact assessment of the current situation. If it is the premium payment, if it is low, that is resulting into health insurance inability to support other diseases or even be able to support the sick, then our government will look at it and implement the outcome of the feasibility study and the impact of the current status quo. Because we have to look at what is happening to the current status quo. As a result of that, this is what is affecting the health institution. We'll look at it. We have always said that Ghanaians should be so much confident in us when it comes to us keeping to the rule of the game. Under them, they made a promise of having a one-time premium. Ghanaians still remember.
So we pay more,
this,
or
so with
what's the
premium,
plan? Yeah.
we will look at the current status quo.
Okay.
What is happening?
I see.
Does it need a premium increment?
Yeah, but what do you
if
plan
it does
to do?
not,
What do you plan to do as the New Patriotic Party?
so for you to be able to plan to do, you must know the current status quo.
Yeah, but
that's
you're
why I'm
in
saying
government,
that.
I
So
believe.
once it is done,
you serve in the New Patriotic Party.
the point is, I'm telling you that I am telling you that we are going to look at it.
But you
look
have,
at it.
They haven't
If you don't look at it, how are you going to?
You have appointed a member of the NPP as the
this thing has just been put. This thing has just been raised here. The person is suggesting.
Yeah.
The suggestion of the person here.
But you are aware
is not
of the challenges.
Bless.
Yeah.
Let us have
I get it,
a
but
productive discussion.
I get it. We're having a very productive conversation.
The suggestion
she's
that is
asking,
made. Yes, she's asking.
Yeah,
so once she's asked, we have to look at it.
Yeah, but what will you commit to?
Once we look at
the
it,
broad framework
the
that
result
the NPP is
of the outcome of what we looked at would inform us the decision we will take.
But your party is serving in government.
You do this to politicians. They sit down, they go ahead, look into the faces of the people, tell them that we will implement this, and they cannot implement that.
So you cannot.
We will assess the current status quo, and the result of the current status quo will inform whether we should increase the premium or not. Bless. That is it. And that is what we are saying. I cannot just look into your face and say, I'll increase the premium. I must look at what the current premium is doing. That will inform what I will do for you, because I am there for you.
So
I should not just look into your face and tell you that we increase premium, then you go home with it. Nana, aren't it the case? That is it.
Haruna, so
the second thing.
No plans for premiums?
There is plans. We have heard them.
Okay.
This program is not in vain.
Okay.
It has brought us together.
Okay.
We have heard the complaint that has come. We will look at the complaint, assess the impact of the complaint.
All right.
That will inform into what we would have to do. We are not here to just promise the people and tell them what they want to hear.
Okay.
We are here to solve the problems of the people. And we must do that based on a baseline.
All right.
And the baseline is, what is the current status quo?
And what do you think it is, actually?
The current status quo is that they are saying that the health insurance scheme needs some relook. And we have put in our mind.
Do you believe that?
Yeah, I believe that.
Okay.
I believe that. There is nothing that is stagnant. That is why we have what we call continuous improvement.
Okay.
You can't continue to do the same thing at the same time, do it continuously and expect a different result.
Right, I see.
So we will look at it and make sure we make input, constructive input into it to make it very good.
DACF allocation to physically challenged people?
Yes, for the disabled fund management, that is why we call it the disabled fund management under the district assembly system. Recently have been increased from 1 percentage point to the other. I disagree with the fact that he's saying that there has not been paying common fund. This has been
they are sitting here.
Common fund has always in arrears.
It's in arrears.
Even under you. You did not come from the mass, my brother. I've worked in the assembly for 18 years.
Okay.
Look
so
at me as a young man sitting here. My age is over. Okay? I have worked within the assembly. It has always been in arrears. Government has never stopped paying. Government has never stopped paying.
Gentlemen, please hold on for me. Yes.
This government have been worse.
Mustafa, just hold on. Mustafa, just hold on for me.
Let's go to Parliament and take the records. What are you talking about? We came from.
Haruna, that's why it's good we're talking to you, because you have a wealth of experience, as you're saying, in the local assembly level. Do we increase it? Do we increase the allocation? What are you committing to? I guess that's what our audience want to hear.
We are committed to ensure that there is timely release of funds to district assemblies to be able to carry out their developmental projects.
Will you increase the allocation? Is that what you plan?
We are not saying that we have done exactly how common fund should be released, but common fund in arrears has always been a concern to all of us.
Okay.
So based on the developmental needs of the assemblies, the government of Dr. Mahmoud Bawumia will make adequate resource to assemblies for development.
Okay, great.
If the need be for an increase, because Common fund is on a formula.
All right.
Based on what is in the basket.
Indeed. And there's a constitutional provision you are aware as well.
There's always a formula, and we are going to stick to that formula. Okay. But the major concern to Ghanaian citizens has always been the timely release of common fund to the district assemblies.
And since we're talking about
the disability, I want to make this point.
Yes, are you talking about the bill?
For the bill,
are you talking about the bill? Because that's what I'm going to. Yes.
Our president is a human rights lawyer, and I believe that when the parliament is done with this particular processes, I have not averted myself to the processes that has led up to where the bill is currently. Okay. So making a forward statement on this matter might not be concrete enough because I have not abreast myself with where the bill is. And I think that once this is made and it is a public and a national platform, I believe that His Excellency the President, the Attorney General, members of Parliament, as and where it is, should make the effort to make this bill available. If it is not passed, we should look at it. Because we've just done with the affirmative action. It has been there on the drawing board for some time. We have dealt with it. The right to information has always been on the desk. We have dealt with it. We will deal with this one too when we get.
So that's a commitment for you out there.
And the point of the persons with our brothers and sisters who are persons with disability. Remember, under the Youth Employment Agency, the money that they were being paid as they were in the toll booth is not the same money that they have been recruited to be paid under the Youth Employment Agency.
How many of them have you recruited so far?
We have recruited 282 of them. The least paid, 282. The least paid of them, 208. You can verify that from the Youth Employment Agency. Under Kofi Adjepong,
do you know out of what number?
I think that the statistics was taken about the total number of them who were manning the toll booth. And I believe that all of them, they are there. The disability, the association's leaders are there. They can verify what I am telling you, that we have done so. The list of them being paid by SSC graduate is not below 2,000 Ghana cedis.
I see.
What were they ending at the toll booth system? So this is being done.
In a minute, what plans do you have for persons with disability? Will they continue doing toll work, or there is a bigger plan that you have?
Disability is not an inability. It is not just working in a toll booth. A person with disability can't be the governor of the Bank of Ghana.
All right.
Can't be a minister, can't be occupying any position at all. We are not looking forward to bringing back the toll booth to say that we are assigning it to persons with disability. We are making more lucrative measures to be able to get them to benefit. And that's why the president, the vice president, and the incoming president said that all persons with disability who will be going to tertiary institution, as in here, the public universities, technical universities, colleges of education, all tertiary institutions in Ghana will go to tertiary institution for free.
I see. This
is feeding what we are making such efforts to go in.
This is feeding into the broad conversation about inclusion. I know the audience is agitated, but unfortunately, we don't have all of the time. So let me do the last part on your behalf. Do I have your permission? I see some women in the audience here.
We are also instituting a learning scheme for those who are doing the sign languages. The vice president, the flag bearer, is putting an effort to get this expanded.
Because of time, what I want to do is show by hand if you have a female here and you are concerned about the affirmative action bill, because it's been passed, yes. So I see a few hands up there. So many people asking questions about this new legislative framework. Because we don't have time, we will not be able to give you the opportunity to ask the questions where we have the microphone. So let me do that on your behalf. Mustafa Agbande, Haruna, Mohammed, you're all here. Your position on the affirmative action bill. I've seen some persons raise concerns already about the bill. But what we might want to do, let me steal some time, shall we? Let's give the opportunity to those who are concerned about the affirmative action bill. Quickly, just do that for us. Get to the microphone. Let's get you the microphone. Then you can ask the question about the affirmative action bill, what your immediate concerns are. Then we get the commitment from the political parties, because it's a critical issue that we need to be looking at. So we'll pass the microphone around. just to wrap up on that point, because inclusion is key, not just for persons who are physically challenged or differently able, but we also need to talk about women. That framework has been passed, yes.
Okay, thank you. So my concern is that, yes, Parliament has passed it, and the President needs to append his signature. When are we expecting this? Because we haven't had any news on it.
Right,
Thank you.
Presidential assent, you say. Any more concerns on the affirmative action bill? Okay. Any more on that? Right. I think, but it sums up the essence of the issue, right? Presidential assent, so then it goes to the quarters of the NPP. And if it's not assented to, which we're not sure of what the president's position is, it will still come back to you, the political parties, Aruna, about what you plan to do about it. So I'm assuming, for now, that the president hasn't signed the affirmative action bill. What will he do? If it's not done, what will the NPP do? So please prepare for that. Then Mustafa will also prepare. One last question on the affirmative action bill.
Am I supposed to answer now?
You will answer. Let's take the last one on the affirmative action. Yes,
so
please go on.
Concerning the affirmative action bill, it's not just about it's being signed or the president appending his signature, but what are the real measures being put in place to ensure that it becomes the real case scenario?
Yeah, not just talk, right? Walk the talk, as Mustafa Gbande is saying. Haruna, you're smiling when we're talking about affirmative action.
Yeah, I believe in that.
It's been passed by Parliament. We're waiting for the president, isn't it?
Yes. You know that the affirmative action was not a private member bill, right? It means that the bill emanated from the corridors of power, right? And this bill has been passed. There is no question as to whether the president will assent to it or not, because he superintended over the development of this particular bill. I am concerned is the effective implementation of this particular bill. I have worked under women in this country who have been heads where I work under them. I have seen how they have been able to shepherd most people in terms of how tolerant, in terms of how they are able to lead some of this particular process and then bringing people together to be able to forcefully make a case.
But it will become a working document, you agree, as one member of the audience is asking, that this will become a working document. So how do we perfect it? What plans do you have? Because some people have already raised concerns about, why are we not reserving seats, for instance, for female aspirants, for instance? What do you have to do about that?
Yes,
briefly?
I think that
we need to wrap up, so you have to be brief about that. So that
the bill itself will have the areas, the thematic areas on which that has to be looked at. And I believe that is why I said that I'm much concerned about the implementation, not just the passage of this particular bill. We as a party, in our contest system, we have always given 50% of the cost for application fees and what have you to women. We have also given 50% of that also to persons with disability.
Do you plan to reserve
today?
Do you plan to reserve seats for women? I guess that's the bigger
for
question.
this one, I, as an individual sitting here, I form part of a body which I cannot take a decision for my party. The second highest decision body making of our party, which is the National Council.
But do you support the idea?
Why not? Because I am telling you
seats,
that I have witnessed leadership of women. And I believe that today, I'm serving under a woman, Madame Obusisai Kofi.
I see.
She is the chairperson of the manifesto implementation, the launch at Takoradi. And I can tell you, her input, her leadership, in terms of what we have to do, has been very monumental.
And
so I believe that
we'll be waiting for that document to come out later this weekend. Mustafa Gbande, we need to go. Your point about affirmative action, reserving seats as well for women.
Then our parliamentary system does not allow for seats to be reserved for a certain class of people, because we emerge through elections. So Ghana doesn't do that. Maybe in South Africa, their system is different. But it is for political parties to create enabling room for women to grow and ensure their longevity in positions and public office. We are not waiting for bills. If there is any group of political parties, or there's any political party that have risen the flag of women so high in recognition of their input and trust of their ability to deliver, it is the NDC. Today, the high office of a running mate who is potentially the first female vice president of the Republic of Ghana, is your own sister, a woman, a professor, an educationist. That demonstrates the NDC's commitment to the affirmative action bill to the highest level. Beyond that, if you look at our parliamentary candidates who are women, they are given separate packages of sponsorship in terms of logistics.
Yeah, but you're not doing any different from the NPP, is it?
No. So that's why I told you that.
Reducing the filing
that's why
fees,
I told you that.
And you know, the same policies.
The degree at which they chase women out of government and out of offices will come to play. Look, we are talking about Ghana here. And we are talking about something that involves human beings. When a man meets you on the street as a woman and he's lying, you can immediately decipher that the man is lying. Whatever we sit here and do will metamorphose into governance.
I see.
Politicians are still in charge of the governance of this country.
Okay.
When you vote for a less committed government, a government that plays chess with your life, your destiny.
So your point is, briefly, we need to go.
Our point is that
just land.
The NDC has a better commitment in terms of affirmative action.
All right.
Bill. Others say lip services. Manifesto committee is 2 days job. You go and launch it, and that is it. It's a committee, but we have demonstrated much more commitment. He knows that.
It's not just about choosing the women. It's about utilizing them.
I see.
When you go to the debate center, go to the House of Parliament, we have always been the greatest number of people giving women opportunity to Ghana's parliament.
All right.
The first female chief justice, was produced by us. It was by appointment, not by voting.
Okay.
We had the power to do. The first female
That's
the first female chief of staff. You see, we will not choose a running mate out of convenience. We will not choose a woman running mate out of convenience. The day we will choose a female running mate, the female will become the vice president of the Republic of Ghana.
Please give a round of applause to these two gentlemen who've supported the conversation all throughout the period for our Ghana Connect Town Hall, which is wrapping up now. A big thank you to Send Ghana for supporting this and making this possible. They've been indeed demonstrating that they're leading the charge in social inclusion and social protection as well. So thank you, Send Ghana. And of course, we'll see you again in our next episode or edition of the Ghana Connect Town Hall. But I'm sure that you've listened to all of the concerns, and we are looking forward to the manifestos of these two main political parties, starting with the NPP, which is happening this weekend. My name is Blessed Soga, and of course, this has been Ghana Connect Town Hall on the Joy News channel, on Joy 99.7 FM, our affiliates, and also on social media, on Joy News, on X, and on Facebook. We'll see you again. Bye from us here at the Osu Presbyterian Hall.